Seeing that yesterday, the World Health Organization said that the Ebola outbreak in the Democratic Republic of the Congo and Uganda constitutes a public health emergency of international concern, highlighting the high risk of further spread and the likelihood that the outbreak may be larger than currently detected. The outbreak involves the Bundibugyo strain of the Ebola virus, for which there are currently no licensed vaccines or specific therapeutics.
The world promised itself it would never repeat the mistakes of 2020. After COVID, governments talked about stronger healthcare systems, faster emergency responses, and better global coordination. Politicians stood in front of cameras promising the world would never again be caught unprepared for another international health crisis. But only a few years later, another dangerous virus is already spreading through Central Africa. And some experts fear the world may once again be sleepwalking into disaster. This time, it's Ebola, one of the most feared viruses on Earth, a disease associated with horrifying symptoms, terrifying fatality rates, and outbreaks that once pushed entire regions into panic. And now, health officials are warning that this outbreak may be different from the ones before it, because the strain currently spreading is not the traditional Ebola variant scientists spent years preparing for. Existing vaccines may not fully protect against it. Early reports suggest it could be spreading faster than expected, of healthcare workers are already becoming infected. And perhaps most worrying of all, the world is now heading toward one of the largest international events on the planet. World Cup 2026. Millions of fans, massive airports, constant international travel, crowded cities operating around the clock, and if this outbreak is not contained before then, the consequences could become global very quickly. At first, this looked like another regional outbreak. The Democratic Republic of Congo has faced Ebola outbreaks before. Normally, international health systems move quickly. Testing begins immediately. Contact tracing starts within hours. Medical teams isolate communities before the virus spreads too far. But according to several epidemiologists, this outbreak is already behaving differently. The strain currently spreading appears more difficult to contain than previous outbreaks. Existing vaccines were designed for older variants, and officials fear the number of real infections may already be far higher than current reports suggest. One of the earliest warning signs came from inside the healthcare system itself. Doctors, nurses, frontline workers, the very people trained to stop the virus, were already becoming infected. And in outbreaks like this, that often signals something much bigger happening beneath the surface. Because if trained healthcare professionals, equipped with protective gear, are struggling to avoid infection, authorities fear the outbreak may already be spreading far beyond what current surveillance systems can detect. Some experts now believe the official numbers may only represent a fraction of the true scale of the outbreak. And that possibility is exactly what has global health officials worried, because Ebola is not feared simply because it is deadly, it is feared because once containment starts failing, panic spreads almost as quickly as the virus itself. But then the situation became even more worrying, because the systems designed to stop outbreaks may no longer be strong enough to respond quickly. During previous Ebola outbreaks, international coordination moved fast. Health agencies shared information rapidly, emergency workers were deployed within hours, surveillance systems tracked infections aggressively, entire communities were monitored before the virus could spread uncontrollably. But according to health experts, much of that infrastructure has weakened dramatically in recent years. Funding cuts, political tensions, reduced cooperation between global health organizations, fewer workers on the ground, slower emergency deployment systems, and during an outbreak, speed matters more than almost anything else. A delay of just days can completely change the scale of a crisis. Experts warn that some regions affected by the outbreak are extremely difficult to reach, testing remains limited, contact tracing is slow, surveillance systems are weak, and every missed infection creates another opportunity for the virus to spread silently in the background. According to several epidemiologists, this is exactly the kind of environment where outbreaks become dangerous. Not because the virus suddenly becomes unstoppable, but because systems fail to react quickly enough. The fear is no longer just about Ebola itself. The fear is whether the world still has the ability to contain outbreaks before they become international emergencies. And after what humanity experienced during COVID, that fear now feels very real. And then came the warning that changed the entire conversation. World Cup 2026. Under normal circumstances, outbreaks can sometimes remain regional, but the modern world no longer stays isolated for very long, and that is exactly why experts keep mentioning the World Cup, because few events on Earth create the same level of global movement, millions of supporters crossing borders, packed airports operating non-stop, international flights arriving every minute, massive crowds gathering inside stadiums, hotels filled with tourists from every continent, entire cities transformed overnight by international travel. In many ways, tournaments like the World Cup represent the perfect environment for large-scale global movement. Now, to be clear, Ebola is not transmitted as easily as airborne viruses like COVID. Health officials still believe containment is possible, but experts warn that if the outbreak expands before international travel peaks, the entire risk equation changes dramatically. Even isolated international cases appearing near major travel hubs could trigger worldwide panic almost overnight. Border restrictions, emergency screenings, flight disruptions, political pressure, public fear. And after what happened in 2020, governments understand how quickly international anxiety can spiral once airports and travel become connected to a potential outbreak. Some epidemiologists now openly warn that the weeks leading into World Cup 2026 may become critically important. Because if containment fails, before millions of fans begin moving across the planet, stopping fear may become just as difficult as stopping the virus itself. What makes this situation especially uncomfortable for global officials is that modern football tournaments are no longer just sporting events. They are enormous international migration events happening in real time. During a World Cup, millions of people move across continents within days. Airports become overcrowded 24 hours a day. Train stations fill with international supporters. Hotels operate at maximum capacity. Fans gather in giant public viewing areas packed shoulder to shoulder for hours at a time. And unlike previous decades, social media now amplifies fear at incredible speed. A single suspected infection linked to a major football city could trigger panic online within minutes. Videos spread instantly. Rumors spread even faster. Governments come under pressure almost immediately. And even if actual infection numbers remain small, public anxiety alone can begin disrupting travel systems across multiple countries. That psychological effect matters far more than many people realize. Because after COVID, public trust in global health preparedness changed completely. Millions of people now react to outbreak headlines very differently than they would have 10 years ago. Authorities understand this. Airlines understand this. Tournament organizers understand this. That is why officials are desperately trying to avoid any situation where Ebola and World Cup 2026 begin appearing together in global headlines repeatedly, because once fear becomes attached to international travel, controlling public perception becomes almost as difficult as controlling the outbreak itself. And in today's hyperconnected world, perception can spread faster than any virus ever could. But the most terrifying warning wasn't about football. It was about the possibility that the next pandemic may already be starting. Some scientists are now openly warning that Central Africa could become the starting point of the next global pandemic, not because Ebola is new, but because surveillance systems remain dangerously weak. Detecting outbreaks early requires enormous coordination. Laboratories, transportation systems, communication networks, healthcare workers, international support, local trust. Without those systems functioning properly, outbreaks grow quietly in the background until they become dramatically harder to stop. And according to multiple experts, the world may already be reacting too slowly. The World Health Organization has now declared the outbreak a public health emergency of international concern, a warning designed to alert governments before the situation escalates further. But some epidemiologists fear the outbreak may already be much larger than official numbers suggest. Because in regions with weak surveillance systems, official case counts often represent only the visible surface of a much bigger crisis underneath. And once a virus reaches major urban centers or international transit routes, containment becomes exponentially harder, especially in a world more connected than ever before. That is why some health experts now believe the next few weeks may determine whether this outbreak remains regional or becomes something far more dangerous. Right now, the world is not facing another pandemic, at least not yet. But experts are sounding alarms for a reason, because outbreaks do not become global disasters only because of the virus itself. They become disasters when systems fail, when responses slow down, when politics weakens coordination, when healthcare infrastructure disappears, and when governments assume someone else will stop the crisis before it reaches them. That may be the most uncomfortable lesson humanity failed to fully learn after COVID. The next global emergency may not begin with panic, it may begin quietly, in underfunded clinics, in delayed testing reports, in remote villages, in airports that still look completely normal, and in football stadiums, preparing to welcome millions of fans from around the world. For now, health officials still believe this outbreak can be contained, but time is moving quickly, and if the response fails, World Cup 2026 may become far more than just a football tournament.